Hello, everyone. I'm Whitney Ortiz, host of the Whole Health series. I'm thrilled to have with us Eleanor LeCain. Eleanor is a speaker, author, and advisor to policymakers who builds on decades of experience in government and campaigns to show practical pathways to building a new America and a new world. Her book, Breakthrough Solutions: How to Improve Your Life and Change the World by Building on What Works, has a foreword by the Dalai Lama. It profiles game-changing social innovations that dramatically improve people's lives. Eleanor was a top issues advisor to Marianne Williamson in the 2020 US presidential campaign and helped elect Elizabeth Warren to the US Senate. Eleanor served in Massachusetts as Assistant Secretary of State and Executive Director of Blueprint 2000, leading strategic planning for the state government. Eleanor hosts a weekly radio show on PRN, and her new book is titled Creating an America That Works for Everyone. Thanks so much, Eleanor, for being with us and sharing your
Oh, it's a great
profound
pleasure to be
wisdom.
here. Thank you, Whitney. Love being with you.
Now, you've been part, Eleanor, of creating transformational change with the world's top leaders for decades, and also documenting very inspiring stories of breakthrough solutions that have the potential and have already been creating an America and indeed a world that works better for everyone. Can you please share through your recent work that we're really truly in a new time now? And what's that really about as we start off our session?
Absolutely. We live, I think, at the most amazing time in human history. And I'm so grateful to be alive now. I believe we're at the dawn of a new era. And I know it can seem very scary right now because so many things seem so bad, and they are. Um, and in some ways, the coronavirus is a great metaphor for our time in that in its advanced stages, the coronavirus leads to multiple systems breakdown in the body. And I think what we're experiencing right now is multiple systems breakdown in our world. And that is, we're dealing with four major systems crises at the same time. We have number one, the health, of course, with the pandemic, but even before the pandemic, many, many major health issues for many people. Secondly, we're dealing with the climate crisis and the changes in our weather patterns and climate disasters happening. Uh, Thirdly, we have extreme wealth inequality, which is leading to many people suffering and struggling financially. And four, we have a crisis in democracy about the rise of authoritarian leaders and the increased power of wealthy people over governments in the United States and in other countries. So I see these are the four major crises that we're facing right now. And I believe we have solutions to all of those crises. And uh, in fact, that's what I wrote my book that you call Creating an America That Works for Everyone. It really addresses each of those four crises and what we can do about them. It's a pathway forward. And I believe the challenges are so extreme that it creates an opening and the opportunity for real transformation and, to build back in a better way than we were before the pandemic hit. So I'm actually very excited about this time in history, as long as we're aware of what's happening and we take action to work for a better world.
Yes, so hope-giving. And if you could please elaborate on what this means specifically for women and preparing us all for managing through these moments and then becoming leaders within this new era that you're talking about, the importance of how do we care for our whole selves to have that capacity.
Mhm. Well, I think the Dalai Lama hit it on the head when he said the world will be saved by the Western women.
Mhm.
And I believe this is the time for women to rise. It's like the rising of the feminine.
Mhm.
It's the time for women to really step forward. When you look at the challenges we're facing and what we need for the world to kind of move through these challenges, it's exactly the kinds of skills and sensibilities that women bring. We need much greater cooperation and less competition. We need greater sensitivity to each other. We need a better ability to work together in groups and get along better. We need essentially kind of a shift to respecting each other and respecting Mother Nature. And if we can get that kind of mindset and soul shift about respecting each other and Mother Nature, that's really at the core of a lot of the policy changes and program changes that we need. And I think women know that. We know that in our guts. And there's never been a greater opportunity for women's leadership than right now. So I think the new era will be led by women in cooperation and collaboration with men. You know, we need to fly with both the wings, male and female, but I believe it's women's time for leadership.
Yes, I'm with you. And in this togetherness of what would be that core message, if you had one, for women who are contemplating right now so much? There's so much on their shoulders. There's so many pulls on their time and energy, and yet they're also hearing this call to do something bigger, bolder, be more visible out in the world. What kind of advice or message do you have?
You are so right. And women are really struggling now. So many women, you know, the young mothers have the young children at home with the pandemic because the schools are shut down, and
Mhm.
the financial stresses can be enormous. And so, yes, there's many challenges. And we need to take care of ourselves. And you kind of had asked that. I didn't fully address it when you raised it, but we women need to really take care of ourselves first, precisely because we have a need for leading our families and our communities, our country, our planet, because the stresses are so great right now. We need to take care of ourselves first so we're in a position to take care of all the rest of it and make the contributions we're here to make. And I remember my friend Cheryl Richardson was on Oprah Winfrey's show in the early 90s, and Cheryl is a executive coach, and she said this thing, women need to put ourselves first. And there was this gasp in the audience. It was like, no, that's too selfish. Women can't do that. And I'm here to tell you, yes, we must. We can and we must take care of ourselves first. You know, I mentioned the first major challenge we've got is health. And even before the pandemic, over half of the people in the United States are suffering from a major debilitating disease like cancer, diabetes, heart disease, so that being very sick is actually the norm in our society. So we need to take steps as a society to address our health. I'll talk about that also. But first, we as women need to take that responsibility, take care of ourselves, be gentle with ourselves, nurture ourselves, eat healthy food, exercise regularly, and, you know, wear that mask and make sure we don't deplete ourselves while we're trying to take care of the families and everything else.
Mhm. And through your work, your books, where you talk about innovative solutions, those who have really been able to step out and through to put forth an idea in the world and really make that happen, which can be very energy giving,
Mhm.
fulfilling one's purpose and going, but really taking that moment to pause, right? That you say that taking a good stock of where one is, physical health, mental health, emotional health, social health, financial health, etc., so that one really has that power, that fuel to go forward. And in your recent research, and as you put together your new book, and you work with women throughout the sectors internationally as well as in the US, what have you found to be some of those common strands that either they're doing really well, that are examples for all the rest of us to look at and say, wow, they're taking care of their whole self and they're making huge impact sustainably, or wow, they're still straining, they're still trying to just power through, and they're going to fall apart if they don't take a moment or somebody doesn't tell them to just slow down and look at it. How are you finding it across the board right now?
Well, I think there's the two responses. One is on a personal level, and the other is societally what we need to do. At the personal level, I think it's really important for women to have support. So the
Mm,
work that Claire Zammit does with feminine power, I've worked with Claire off and on for years, and she does a fantastic job with feminine
mm,
power. And I encourage people to check out Claire Zammit and the Feminine Power program for that kind of support right now. So
mm,
whatever it is, whether it's that or something, but make sure you have support to get through everything. And then on the societal level, I think there's uh, some new winds blowing. I live in Washington, D.C. We've got a new president coming in on January 20th. And there's so much that we could be doing. In fact, I'm hoping the book that I'm writing, Creating an America That Works for Everyone, that addresses our four major problems, can be a guide for the next administration. But one of the things on it is around health, and that the debate had kind of gotten lost in the 2020 presidential campaign. The debate was all about how do we pay for healthcare, which of course is important. But what gets lost in that debate is the need for addressing the underlying root causes of the problem. Why are so many people getting
mm,
sick? And we're getting sick in part because, like for women, women are carrying so much on our shoulders. We're struggling to raise the young children. We're struggling to earn money, even though our pay is lower than men in general. And we're struggling because we're taking care of our parents or our loved ones, and we're trying to do our work and keep our jobs. So there's tremendous stress on women right now, and that stress can lead to illness. And so we need to remove those stresses. We need to pay women well. Uh, that's critical. Equal pay is still something we need to be working towards and bringing about. We need to look at some of the other root causes of health are the toxins in our environment, and removing those toxins in our food, our air, and our water. Big business has had too much influence for too long in our decision making in government. We need to have strict monitors that protect people from pollution and toxins. So we need, when we go upstream with the health and we make life better for people, that will reduce stress, that'll reduce illness, and that'll reduce the cost of the whole healthcare system. We need to take the money and put it into addressing root causes upstream so fewer people are sick downstream. And financially, that works out really well as being more humane because more people are healthy and vibrant and contributing to our communities.
mm. If I could stand up and applaud you, I would right now because I am 1,000% behind those key messages and
Yeah,
with you as the future of healthcare. What is
right.
the care we all really need?
Exactly. And if I may add, the other thing I think that's really important is we have many modalities to help people keep healthy. There's like over 100 uh, natural health modalities that we can draw from: acupuncture, yoga, massage, supplements. There's a whole array of ways to get healthy and stay healthy that are not compensated or covered by most health insurance. So it's one of the things I call for in this book is that we should have evidence-based research showing what is really effective. Like right now, there's 30 different drugs for statins. Which one is most effective? Who knows? We should do the research, which are effective, and focus on those. But maybe what's even more effective, as Dr. Dean Ornish says, is having regular exercise, having certain kinds of healthy food, having social connections, having meditation and calm, mindfulness and relaxation. That can be even more effective than the drugs that are being used. So we need to have science-based research showing what's effective and have that be covered. And if it happens to be yoga or acupuncture or whatever, we should be doing that
Mhm.
instead of the drugs that are kind of the line of first attack by most medical doctors, because Western medicine is trained in drugs and surgery. As one Harvard medical professor told me, we either try to kill it with poison, the drugs, or we try to cut it out through surgery. Now, there are times you need medicine, pharmaceuticals, and times you need surgery. There's amazing things done with that. But for many illnesses, we could either prevent them or treat them in a less invasive way, in a less expensive way, in a more effective way by some of these longstanding natural modalities. And these are not risky, like off the shelf new experiments. Acupuncture has been practiced in Asia for thousands of years. So I think we need to have those approaches be covered by our healthcare when they're shown to be effective.
I'm 1000% again with you, and which is at the root of the nonprofit I lead, which is Eleanors Light, working at that systemic level, because as you say, it
Yes.
needs to be across the board instead of just in small pockets of innovation around the country. And what you've done so well is really capturing some amazing models over time and saying, this is what works here, folks. Take this and see how we can replicate and scale it, and giving more voice and awareness to certain ways of doing things that others have just poo-pooed on the side and said, oh, that's something nice to do, or it's working well in that community, but can't really focus on that now, or we need the big bucks, so it's overwhelming. And but really it is those small steps forward in collaboration, as you call for, and that allowing with that feminine energy, as you say, which is the type of leadership many are also asking for, that collaborative approach. No competition. It's all about how can we all together make this world a better place. So how can people engage with you and access your books, follow your work moving forward, Eleanor?
Yeah, that's great. Well, I have a website, which actually I just put up last month, but it's eleanorlecain.org. And I think you've got my name spelled out there. It's an unusual name, but yeah, if you go to eleanorlecain.org, you can see my first book is available there now. That's the one with the Dalai Lama forward. That's the survey of 9 breakthrough solutions. If we would adapt and adopt those programs, we could improve the lives for millions of people for billions of dollars less than we currently spend. So that breakthrough solutions book is already up there and available. And then the forthcoming book, it should be out in early 2021, Creating an America That Works for Everyone. And also on that website of eleanorlecain.org, then you can see some of the speeches that I've given, like the keynote at the Shift Network, which is the keynote for governance planet-wide. What do we need to do at this time in history? So come and visit. It's free. I'd love to have you come and learn and share me what you're doing. Let me know what's up with you. And if you know a breakthrough solutions, tell me. That's how I find out a lot of some great programs is people who are listening in and say, hey, have you heard about this? So it's a partnership with all of us to find what's working and adapt and adopt it around the country and around the world so we can uplift the most people the fastest way for the least amount of money by building on what works.
Yes. So hope giving. Thank you so much, Eleanor, for being with us and for sharing these messages of wisdom, inspiration, motivation. Thank you.
Thank you. It's a great honor and a pleasure. I wish you all the best.